Hello and welcome to Pulse Check with Archer Nursing, where nursing comes to life. In this podcast, you give us 15 minutes of your day, and we'll take one complicated nursing topic and make it easy. Ready for nursing to be fun? I'm Morgan, and today we're going to talk all about how you will know if you are really ready for the NCLEX. So, of course, this is a topic mixed with a lot of anxiety. We all want to really know 100%, are we gonna go pass this exam? And none of us can know 100%. It's not certain, but there's a lot we can do to really increase our confidence and have a lot of good data to prove, yes, I'm ready, I can do this, let's go, let's take this exam. So the first thing I want to talk about is redefining ready. Just because you have graduated automatically does not mean you're ready for the NCLEX. When I say you're ready, what I mean is that you can think like a nurse, you know your priorities, you prioritize patient safety, you can follow that clinical judgment model, right? Number two, you can handle NCLEX style questions at that high difficulty level. And number three, this is a really important one, and this is the one that gets missed, is that you can manage your testing anxiety enough to actually use what you know. So there's knowing what you know, being able to think like a nurse, being able to handle the test questions, and then not being so anxious that we can't apply what we know to said questions and get them correct. A lot of us really know our stuff. We have been studying for years at this point. It's not about the fact that we don't know the content or that we don't know how to take these types of questions, but sometimes we get in that room. It's an unfamiliar environment. It is really stressful. The weight of the world is on our shoulders, and we just can't function. So managing that, like having a plan for that, knowing yourself, knowing what works and doesn't work for you, is a really critical point to actually being ready. So if you're actually ready, you know your stuff, you know how to take the questions, and you know how to deal with the anxiety. But I'm going to give you really specific data-backed checkpoints that help guide you along the study journey. So you're not just guessing about if you're ready, but you're actually checking off, okay, am I thinking like a nurse? Am I getting these questions? Am I applying this knowledge? Am I doing what I need to do? And I have three of these data-backed checkpoints for you. The first is going to be your Archer Readiness Assessments. The second is going to be your Archer CAT exams. And then the third is going to be your Archer RN exit exam. Each of those come at a certain point. Again, I'm all about the datas. If you guys know me and you've already watched any of my videos, you know I am obsessed with all of the numbers. So these are going to be really crystal clear check marks for you to write in your notebook and be like, I've done this. Yes, I've done that. Check. I know I'm ready for this NCLEX. So let's jump in. Our first check is your Archer Readiness Assessment. So what is a readiness assessment? This is going to be, I call it an 85 question mock NCLEX because it's always 85 questions. It is not adaptive because I am giving you a very specific set of questions at a specific difficulty level. They are meant to be shorter, they are focused, and they give you a band of how ready you are. So I'll explain that. We have four kind of categories in this band that range from low to very high. So if you get a low, you will obviously have a low chance of passing the NCLEX. From there, it goes up to borderline, then high, and then very high. You are aiming to score in the high or very high band of the readiness assessments. What does that actually mean? It means that you have performed higher than your peers have on that specific set of questions. It does not equate to a specific score. You're like, do I need to score a 65%, a 75%, an 80%? It literally is different for different readiness assessments because different questions have different difficulty levels. So for every readiness assessment, it's going to be a slightly different percentage. I don't care about the percentage. I don't care about the percentage at all. Stop looking at the number. The NCLEX doesn't work like our tests in nursing school worked, where we're like, I need a 90 for an A and 80 for a B. Literally is not graded like that at all. It is graded off of a passing score or a cut score, where that is the threshold of knowledge you need to have on that specific set of questions. So let's say my peers took these practice questions and they averaged scoring 60%. And then I came in here and I scored a 70%. I did at least one standard deviation better than my peers did on those specific questions. So I got a high chance of passing. Those numbers are gonna look different for different ones of our readiness assessments, but what matters is that band that you get put in. So if you get a high or a very high, check it off in your notebook. That is your first bucket that you are trying to achieve. And I actually don't really care if you've done it once or done it twice. I care that you have done it 4 times in a row. I want to see 4 times in a row that you score high or very high, because that tells me it's not a one-off. You are consistently exceeding how well your peers are doing, which is how the NCLEX works. And the data shows us that if you get 4 scores of high or very high on 4 consecutive readiness assessments, you have a 99% chance at passing the NCLEX. 99% chance. 99 out of 100 students who did what you did have passed their NCLEX. So that is your first confidence check. If you have gotten 4 scores of high or very high in a row, you can walk into that exam and be like, okay, 99% of my peers did this. I have so got this. So that is your first data-driven point. Am I ready for the NCLEX? Have I gotten 4 highs or very highs on my readiness assessments? And that tests, if you're scoring above your peers on those 85 question mock NCLEXs. So the next thing you need, step 2, is can you go the distance? Can you do up to 150 questions? This is where you're going to do adaptive testing with the Archer CAT exams. CAT stands for Computer Adaptive Testing. And this is how your exam on the NCLEX is going to be delivered to you. So let's recap a little bit the way that works. Basically, you're going to start off with an easy question. If you get it right, you move on to a harder one. If you get that right, you move on to a harder one. If you get it wrong, they're going to drop you back down to a little bit of an easier question. I kind of like the analogy of lifting weights. I start off with a 5-pound dumbbell. I can do it no problem. I move on to a 10, a 15. Maybe when I pick up that 25, I drop it. Not very strong, you guys. 25 actually might be what I would drop. So I'm going to go back down. I'm going to try 20, see if I can do that over and over again. And whatever weight, which equates to the difficulty level of our questions, I can consistently hit without dropping that weight or getting that question wrong, is where my test is going to say, okay, this is my level of proficiency. I can lift a 20-pound dumbbell. I can get, a medium question correct over and over and over. And you have to get to a certain point to show the exam, hey, yeah, I can get to this cut score. I can do this over and over at a safe level, okay? So if you're not able to get those hard questions right over and over without dropping the weight, without getting them wrong, then the exam's going to turn off and that's going to be a fail. But if you can get them right over and over, you're hitting that heavy weight, you're getting that hard question correct, then you're going to prove that you are a safe new nurse and you're going to get the result of pass. So step 2 in knowing that you're ready is knowing that you can handle the adaptive nature of the test and that you can go up to 150 questions. You can pass or fail at 85. You can pass or fail at 150. Okay, y'all, I don't care how many questions you get on the NCLEX. Literally doesn't matter to me whatsoever. That is just the number of reps you had to do to show the computer your stuff, to show them where you can consistently pick up that weight. So you need to go do Archer CAT exams. I recommend once per week. They will adjust to your ability level. They will adapt just like the real NCLEX. And this will show us a few things. you can sustain your focus over that long adaptive exam. You've built that testing endurance, you've got that stamina. Number two, you have familiarity with adaptive testing. This can help reduce your testing anxiety. This puts you in the environment of the NCLEX. This gets you used to it to do the real thing. If you have multiple times where you are passing your Archer CAT exam, this is a really strong signal to me. Not only do you know your stuff, you've already proved that in bucket number one, but you can also handle the NCLEX format, the pressure, and that adaptive testing component, okay? If you are struggling to finish these CAT exams, if your performance is dropping off late in the exam, you need more endurance practice. You need more stamina. And that's different than just drilling yourself on the content. These are multiple different skills, okay? So that's the second bucket that you're going to want to check off to tell yourself, yes, I am really ready for this NCLEX. Remember, bucket number one, you're going to get 4 scores of high or very high to prove you know your content. You're scoring above where your peers are scoring. Number two, you need to see multiple passing CAT exams, showing us you can handle the NCLEX format. You know how to handle that adaptive testing. All right, that's step 1 and 2. You have one final step here, your final check off to prove to yourself beyond a shadow of a doubt you are ready for test day. And that is the Archer RN exit exam. This is your final check before you are like walking in that door on test day. All right. You've already proved you know the content. Then you've proved that you can handle the adaptive testing. So this last check is going to be a 150 question mock NCLEX. It is a comprehensive high stakes readiness indicator that will literally tell you, yes, you are ready. No, you are not ready. It again is going to give you a band. So it's going to show you low, borderline, high, very high. But here's the thing. If you get a high on the Archer RN exit exam, you have exactly a 95% chance at passing your NCLEX. If you get a very high on the Archer RN exit exam, you have greater than a 99.99% pass likelihood on the NCLEX. So I want you aiming for that very high. If you get a high, I'll take it too. But when you get that score of high or very high on your Archer RN exit exam, you have not only proved I know the content, I'm scoring above my peers. You've not only proved I can handle the adaptive testing, you've also proved I have the endurance. I can go up to 150 questions. I am ready for this, and I am going to pass in every client need area. Okay. So you're walking in there with a whole lot of data that proves to you, yes, I am ready for this exam. Step 1, you get 4 highs or very highs on your readiness assessments. Step 2, you pass your CAT exams. Step 3, a high or very high on the Archer RN exit exam. And those are the 3 big data proven buckets that I want you thinking about on test day. I want you walking in there knowing, okay, I did the work. I have proven that I know my stuff, and the numbers are behind me. The data backs me up that I am ready for this exam. I would be remiss if I didn't just briefly mention, though, that even with doing all of this, you still need to prepare for testing anxiety. Most, if not all of us, have some level of anxiety when it comes to taking our NCLEX. All right, let's just be honest. It's anxious. It is a high stakes situation. A lot of us have jobs that are riding on this. Our families depend on us. It feels like the whole weight of the world is on this one exam. I am here to reassure you, some of the best nurses I know have failed the NCLEX on their first try. I don't care if it takes you 1, 2, or 17 times. I believe that you are going to be a great nurse, and Archer is going to help get you there. That being said, one of the biggest things you can do is just know yourself. Know if you have some of that testing anxiety and what can really help you prepare for it on test day. So specific things, I want you making sure that you've watched your Archer on-demand video about testing anxiety, because we give you very specific, very practical strategies for how to handle it. And just knowing that you have a plan is really, really big. Practice those strategies. Some of the things we talk about in the videos are box breathing, the 3-2-1 method. There are lots of different things out there. If the on-demand video wasn't enough for you, you can join us in a live webinar, you can join us in a tutoring session, and we will walk through personally what works for you and practicing and making a customized plan. But the bottom line, because this is a whole nother episode to get into on testing anxiety, the bottom line is to know yourself, be prepared for some level of anxiety, and have a plan on how you're going to manage it. Don't go in there unprepared. You didn't go in there unprepared on your content. You studied your content out the wazoo, and you took all your readiness assessments and your CAT exams. So you've done the testing endurance, the content, blah, blah, blah. Don't skip out on prepping your nervous system, on knowing yourself, and on having a plan to cope with anxiety, because it happens all the time that I have students who really know their stuff. They come in, they tell me that they haven't passed. We go kind of look at what has happened, and they had massive testing anxiety that kind of took over in their brain, logged off. We can prevent that. We can work on that with you. So let's set you up with a plan for success. That'll be kind of the last component of knowing, yes, check, I am truly ready for this NCLEX. And that was the purpose of this episode, right? How do I know? How am I confident that when I walk into this exam, I am going to pass? So we'll end with a little checklist here for you, okay? Make it nice and simple. So number 1, I have 4 scores of high or very high on an Archer Readiness Assessment. Check, you're good. Number 2, I have passed at least one, if not more, Archer CAT exam, that computer adaptive testing. I've shown I can tolerate that full length and the pressure of adaptive testing. Check. Move on to your next one. Number 3, I've taken that Archer RN exit exam. I've got a high or a very high, showing me that percentage likelihood that I am to pass the NCLEX exam. And I'm going to use all of that data to really bolster my confidence and walk in there knowing that I can do this. Your 4th and final check, I have intentionally prepared for testing anxiety. I've watched the Archer On Demand video, joined a webinar or a tutoring session if I've needed more support. I know myself, and I've got a plan for game day. You guys have so got this. Knowing that you're ready, being ready for the NCLEX, it's not just a vibe. It is a set of receipts. We've got these data-driven checkpoints that tell you, yes, you know your content. Yes, you're ready for that adaptive testing format. You are scoring where you will pass the NCLEX, and you have a plan for your testing anxiety. You guys, when you go through this checklist, you do not have to guess. You have used the data points to know that you are taking that exam from a place of confidence and that you are going to be a great nurse. All right, future nurses, that is a wrap. If you found this pod helpful, I'd love to continue supporting your nursing journey through nursing school, the NCLEX, continuing ed, and beyond. Archer Nursing has you covered with on-demand video lectures, high-yield question banks, live case study reviews, and so much more. We want to help you master tough concepts and make it fun. So join us over at archerreview.com. Follow us on socials at Archer Nursing for more free nursing tips and study resources. Thanks for tuning in to Pulse Check with Archer Nursing. I'm Dr. Morgan Taylor, and I'll see you back next time.